Hello and welcome to Chairside Live. I'm your host, Megan Strong. Thanks for checking out this episode. It's going to be a good one, and here's why. Dr. Chi is talking about placing his very first implant. He's discussing the training, classes, and mentorship that gave him the confidence to take the plunge into implantology. He's walking us through the steps he took to prepare for his first implant case and sharing what he's learned along the way. If you've been toying with the idea of placing implants, now is the time. So let's see how Dr. Chi used the Hahn surgical kit to place his first implant with ease and confidence. Dr. Chi, it's all yours.
As a clinical research associate at Glidewell Laboratories, I've specialized in digital workflows and putting the latest tools into use on a daily basis. The work has been extremely rewarding because it allowed me to share tips and best practices for dentists to become more efficient through digital impressions, in-office milling, and other digital technologies. Entering implantology was a natural and exciting next step for me to expand the ways I can serve patients and gain more insights to share with fellow practitioners. My first encounter with implantology was in dental school at USC, where we didn't have an official surgical implant program, but we did shadow a perio resident for a couple of cases. We would take the diagnostic impressions and we would wax up the tooth in the edentulous space. From that wax up, we would create a surgical guide and provide that to one of the perio residents. We would also assist during the procedure. More recently, I completed training with the MISH International Implant Institute. I went through surgical sessions 1 and 2, which were excellent courses. They provided the didactic information and hands-on exercises that really showed me how to get started, and the hands-on portions were particularly helpful because we practiced on models and pig jaws and went through the protocol for the Hahn Tapered implant surgical kit. One of the biggest takeaways from my training with the MISH Implant Institute was that successful implant cases begin in the planning phase. With these courses, you're learning what to look for, identifying the anatomical structures, taking the right preoperative impressions and intraoral views, and assessing the patient's health, x-rays, and CT scans. Because when you're dealing with an edentulous space, you have to plan in all directions. You have to understand the occlusion, you have to know the condition of the adjacent teeth, and of course, the status of the bone and soft tissue. You're factoring all of that in, and that's more to consider than with a non-surgical restorative procedure. Once you incorporate all of this information in the planning stage, then you can go about the implant placement in the best way possible. For my first case, I had a patient who was missing tooth number 30, which she said was removed in 2008 and restored with a bridge from number 29 to 31. In 2011, she went to a dentist who cut through the ponic and tried doing Invisalign to push the teeth forward to close that space. The patient didn't think that the strategy was working out the way it was intended, so she stopped the orthodontic treatment and came to me with this problem. Dr. Sia Makabai, Director of Clinical R&D at Glidewell, removed the old crowns on tooth numbers 29 and 31 and replaced them with Bruxer anterior crowns. We planned out the case together, and I was able to use the information that I had learned from the MISH courses backed by Dr. Abai's guidance. It was great to have someone who's experienced in implantology verify what I was thinking, and Dr. Abai was there for the implant placement too. He served as support in addition to being the photographer, and having him around really helped a lot. Since the patient in this case had some ortho, tooth number 31 was just a little bit tilted over. The intraoral situation wasn't too unusual though, considering the posterior teeth distal to an edentulous space typically will shift over. The space now is almost like a space for a premolar, so we're going to have to compromise a little bit in the final tooth design. I'm planning for about 4 months of healing time, and then most likely the final restoration will be a Bruxer screw retain crown. Screw retain has some advantages regarding placement technique, and if for any reason you need to remove the crown, you can do that relatively easily. While completing the procedure, I did not encounter any negative surprises. but I was pleasantly surprised by how straightforward the process was. The actual procedure didn't take a lot of time because the time for the procedure is really spent beforehand in the planning phase. So once you open the flap and expose the bone, you're making sure the ridge is level and no modifications need to be done. Then you can just go through the steps of the Hahn surgical kit. Having practiced with the Hahn kit on a Tapered model, I found that using it on the patient was virtually the same thing. If you follow the layout of the kit, it takes you from A to Z in the easiest way possible. Everything is provided for you. Completing this first implant placement was exhilarating, and I'm happy to report that the patient was very pleased with the results. Of course, she felt nervous beforehand, but my staff and I ensured she was extremely comfortable throughout the procedure. The recovery period also was a lot easier than she had expected. I'm thrilled with how this case is progressing, and I'm looking forward to seeing the final restoration. If you're interested in making the transition into implantology, my first recommendation is to seek out the mentorship of others. That's why we go to these courses. You're learning from people who have seen the full range of scenarios and are able to provide you with the most relevant information. With the MISH Implant Institute, they train for everything from simple to complex cases too. There are also so many excellent resources online. Even before I went to the MISH training, I went on glidewelldental.com and watched YouTube videos, including our own Chairside Live, because it's really about seeing that information and those procedures over and over. With the right courses and resources, you will feel more comfortable and confident, and with that foundational knowledge in place, any dentist can successfully place implants. I wish you all great success with your first implant.
Thank you for that, Dr. Chi. Well, that about wraps it up for this episode of Chairside Live. On behalf of everyone here at Glidewell Laboratories, thank you for watching, and I'll meet you right back here next time.